What would you do if you were vomiting blood? Internal bleeding is always a serious problem. Vomiting blood suggests bleeding from the upper intestinal tract, or specifically the esophagus and stomach. Causes can range from concerning to very concerning, so it is important to know what you're up for. Hi, I'm Dr. Fan, Australian-based specialist general surgeon, here to talk to you about haematemesis. Haematemesis is just a medical word for vomiting blood. The blood can be bright red if it is fresh, or look like coffee grounds if it has been partially digested. Fully digested blood comes out the backside as black poo, also known as melena. It is an uncommon scenario which affects about 1 in 1,000 people every year. There are a number of causes for such bleeding, the most common two being peptic ulcer disease and esophageal varices. Peptic ulcers are ulcers in the stomach or small bowel, specifically the duodenum. These are deep erosions in the stomach or small bowel lining that can bleed when underlying blood vessels are exposed. Esophageal varices are swollen veins that occur in the esophagus, typically in liver disease. Such swollen veins can easily bleed from otherwise minor lacerations of the esophagus. And because the veins are swollen, they can bleed a lot. Another concerning cause is cancer in the stomach or esophagus. These often do not cause any other symptoms, so it is important to have it investigated thoroughly. There are, of course, other minor causes of bleeding, such as tears in the esophagus from severe vomiting, but all bleeding should be investigated thoroughly. If you bleed a large volume, you will likely become anemic, and that can be life-threatening. You will require urgent medical attention, and that can include having a blood transfusion. Therefore, it is important to go to the hospital urgently. Your doctor will assess you and take a number of blood tests to assess your situation. Ultimately, you will need to have an upper endoscopy to assess your esophagus and stomach and small bowel. This will allow us to visualize the problem and potentially treat it immediately. Well, I hope that you now have a better understanding of what needs to be done if you are vomiting blood. Comment below if you ever had such an experience, or if you have any other topics you would like to cover. Please like, subscribe, and share for more content.